Good afternoon and welcome to our presentation titled Healthcare Addressing Urban and Global Challenges. My name is Bettsy Morales and I'm presenting today alongside Nayla Torres and Evelyn Villalpando. This presentation was developed as part of our coursework for Urban Issues in a Global Environment under the guidance of Professor Damaris Cortez, LMSW. In the next few slides, we'll explore how healthcare is impacted by a range of complex and interconnected factors, particularly in urban settings and across different regions of the world. Our focus is to highlight not only the challenges, but also the opportunities for improvement and innovation within healthcare systems. From disparities in access to the influence of political and economic structures, we'll examine the layers that shape health outcomes in both local and global contexts. Thank you for being here with us, and we look forward to diving into this critical conversation. Let's begin by understanding what healthcare truly encompasses. Before we delve deeper into the challenges and disparities in healthcare, it's important to start with a clear definition of what healthcare truly encompasses. According to the Institute of Medicine, healthcare implies a broad set of services including acute, chronic, preventative, restorative, and rehabilitative care, which are delivered in many different settings by many different healthcare providers. This definition highlights the comprehensive nature of healthcare. It's not just about treating illness, but also about preventing it, supporting recovery, and improving quality of life. Healthcare is delivered in a wide range of environments, from hospitals and clinics to community centers, nursing homes, and even patients' homes. And it involves a diverse team of professionals, including doctors, nurses, therapists, social workers, and many others, each playing a vital role. Understanding this broad scope helps us appreciate the complexity of the system, as well as the importance of ensuring that care is accessible, coordinated, and responsive to the needs of all populations, especially in urban and global contexts. As we begin to explore the complexities of healthcare in both urban and global contexts, it's essential to establish a clear understanding of the foundational terms that shape this discussion. First, healthcare access refers to the timely use of personal health services to achieve the best health outcomes, a definition provided by the Agency for Healthcare Research and Quality in 2020. This concept highlights not just the availability of services, but also their timely and effective use. Next, we must understand health disparities, which are defined as the difference between population groups in the way they access, experience, and receive health care. These disparities often reflect underlying social, economic, and environmental disadvantages that disproportionately affect marginalized communities. Another important term is universal health care, which according to the World Health Organization means that all people have access to the full range of quality health services without financial hardship. This global ideal emphasizes equity, quality, and protection from financial strain. Lastly, we address economic barriers. These are financial constraints that prevent individuals from accessing healthcare services. Examples include a lack of insurance coverage, high deductibles, and other out-of-pocket expenses that make care unaffordable for many. Having these definitions in mind will help us better analyze and address the challenges that lie ahead in creating equitable healthcare systems for all. Healthcare is a critical topic because it does not exist in isolation. It intersects with nearly every aspect of our lives and societies. First, it connects deeply with social, economic, and psychological factors. A person's ability to access care, their health outcomes, and even their perception of health are all shaped by their social environment, financial situation, and even mental well-being. Healthcare also involves both the public and private sectors. Government systems and private entities share responsibility in delivering care, influencing access, affordability, and quality. The balance between these sectors can vary widely from one country or even one community to another. Geographical region plays a major role as well. Urban versus rural access, regional health infrastructure, and transportation barriers can all determine whether people can reach the services they need. Then we have economic resources. Wealthier areas may offer more advanced facilities and more providers, while under-resourced communities often struggle with shortages in care, equipment, and staffing. Finally, political frameworks heavily influence healthcare policy, funding, and delivery. From universal systems to market-based models, the political climate shapes who gets care and how it's paid for, and what's prioritized. All of these elements together make healthcare a complex and pressing issue, one that demands our attention and innovative solutions both locally and globally. In our presentation, we'll focus on two specific areas of interest: urban challenges in healthcare and global challenges in healthcare. Both present complex and evolving issues that significantly impact patient outcomes, system efficiency, and health equity. Urban environments often face unique pressures, like overcrowded facilities, disparities in care, and environmental risks. While on a global scale, challenges like limited access, workforce shortages, and funding constraints continue to hinder progress in low-resource settings. We'll explore each of these areas in more detail in the next two slides, starting first with the urban landscape and then broadening our scope to global health systems. Now let's take a closer look at some of the specific challenges that urban healthcare systems are currently facing. First, we have health disparities and inequality. In many urban areas, there's a stark contrast in healthcare access and outcomes across different populations, often driven by socioeconomic status, race, and neighborhood infrastructure. These disparities contribute to higher rates of chronic illness, mental health conditions, and preventable diseases. Next, environmental and public health risks are particularly intensified in urban settings. Issues like air pollution, lead exposure, poor sanitation, and lack of green space directly impact public health and increase the burden of healthcare systems. A major concern in cities is overcrowded healthcare facilities. High population density often leads to long wait times, staff burnout, and limited bed availability, especially in emergency departments and public hospitals. Access to care and transportation is another pressing issue. While urban areas may have more hospitals or clinics, physical access isn't guaranteed. People living in underserved neighborhoods may face significant barriers, such as unreliable public transportation, financial constraints, or lack of nearby services. These interconnected challenges create a complex web that urban healthcare systems must navigate, and addressing them requires a multi-layered approach involving policy, community engagement, and systemic change. Shifting to a global perspective, we see that healthcare systems around the world, particularly in low and middle income countries, face several persistent and interconnected challenges. First, there is limited access to healthcare in low income countries. This includes not only a lack of physical infrastructure like hospitals and clinics, but also shortages of essential medicines, diagnostic tools, and basic medical equipment. For many communities, even primary care is difficult to reach, leading to preventable illness and mortality. Second, we encounter workforce shortages. In many global regions, there simply aren't enough trained healthcare professionals to meet the needs of the population. This problem is exacerbated by migration, where providers leave low resource areas for better opportunities elsewhere, creating a significant imbalance in global health capacity. And finally, inadequate funding remains a critical barrier. Without stable and sufficient investment, health systems struggle to build sustainable services, respond to crisis, or invest in innovation. Funding gaps can also limit public health initiatives, education programs, and emergency preparedness. These global challenges highlight the urgent need for international collaboration, sustainable development efforts, and long-term investment in health systems, especially in the world's most vulnerable regions.
Diving deeper into the health disparities and inequalities that significantly affect both the urban and global environment, we can see several factors that influence health outcomes. In urban areas, social economic factors create barriers to healthcare, nutritious food, and safe housing, leading to poor health outcomes. Environmental issues such as pollution and overcrowding further impact vulnerable populations like racial minorities and the elderly. On a global scale, research allocation is crucial. Many low and middle income countries lack adequate healthcare infrastructure, making them susceptible to infectious diseases like malaria and tuberculosis. The disparity in healthcare systems worldwide also affects access and quality of care. In summary, tackling these disparities requires a multifaceted approach that addresses socioeconomic and environmental factors. By promoting health equity, we can improve well-being for all. Whether we are looking at urban or global communities, promoting health equity remains vital. Every community should receive quality care. Health as a human right, regardless of socioeconomic status, geographic location, or race, everyone deserves the opportunity to live a healthy life. Now, healthcare and social determinants of health. Quality healthcare is tied to other determinants of health, such as education, housing, income, and employment. This is why individuals in vulnerable communities are more likely to experience poor health outcomes. Now, impact on vulnerable populations. Marginalized groups such as the elderly, immigrants, and people with disabilities are disproportionately affected by preventable diseases, mental health challenges, and chronic conditions. Now, health equity, where everyone should have the opportunity to reach their full health potential regardless of their background or circumstances. In recent years, we have seen that BIPOC identified individuals have been negatively affected by the healthcare system. In some ways, are that there has not been enough research on how to help them in their unique illnesses and generalizing the solution that works for one community, assuming it would work for them too. Their doctor visits have not been up to the professional standards. Some individuals are traumatized by how they are fastly dismissed, not wanting or having built trauma to come and visit a doctor due to fear not getting the proper treatment. These are the lives we're talking about. Some health insurers that are out there for the public are Medicare, that is for 65 and up. You may be eligible or approved if you're younger, if you have a disability. Medicaid is for low-income families, women pregnant, kids, and older adults. CHIP is for low-income families, women pregnant, kids, and older adults. And kids could receive CHIP up until 18 years old. ACA, which stands for Affordable Care Act, it was a health care reform back in 2010, aiming to provide affordable health care to the public. Healthcare. According to Wong et al., 2013, when there was an income of $20,000 per year, there was a major increase in inaccessibility to healthcare, which it was not just one type, it was from dental to even mental health care. Next, according to TSA 2023, 2 years back from today, there was a decline in percentage. 10.7% of Americans that did not have insurance, but that only lasted a small amount of time, a quarter. Next, and lastly, when it comes to affordable healthcare access, only about 40% of Americans can afford an emergency expense without going into debt, highlighting financial instability that limits access to essential healthcare services. Perspectives on healthcare. How is healthcare viewed by government agencies? They see it as a for-profit in the U.S., which is in how hospitals handle insurances and bills. Policymakers, they are more on a holistic perspective, working for the best interest for the people, trying to take into perspective everyone's lives and how everyone could benefit equally. Public versus privatized. If you have a private insurance, you're more likely to have a primary healthcare provider receive better assistance, while government insurance can minimize your options to where and who you are able to receive help from. Next, global comparison of healthcare systems. Other places in the world provide free healthcare, only work within private insurances, or have the option of both, either private or public. The future of healthcare is driven by innovation, collaboration, and focus on equity. Technology integration. Like AI, the telemedicine is improving how we diagnose and deliver care. At the same time, personalized and preventative medicine is helping to catch issues early and tailor treatments to individual needs. Now, global collaboration is key as we respond to shared challenges like pandemics and climate-related health risks. There is also a growing push for universal health coverage, aiming to make care accessible and affordable for all. Finally, the future depends on a strong focus on health equity and addressing social determinants like housing, education, and income that impact health outcomes. In this slide, we're going to look at healthcare approaches in different communities, specifically rural and urban. What to look for. So starting off with rural, the distance between the home and the closest healthcare facility takes into account how fast a person can receive help, as well as there tends to be more severe healthcare issues within the rural community due to a delay of seeing a healthcare professional. There may be a bigger percentage with no insurance, with people with no insurance, and there, because of the distance of the health facilities, there may be few workers or healthcare workers in these facilities, and it is a bit more expensive for those living in the rural areas. Now, in the urban area, sometimes overcrowding in hospitals can affect the delivery and the proper help to individuals. There is social and economic disparities as well. They do have to worry about the pollution. That's one of the factors that may affect their health, on why they will have to see a healthcare professional. In both areas, they do have local pop-up truck healthcare opportunities. In the urban areas, sometimes there may be free or minimum charge.
With decision on healthcare. Based on our research, we believe that healthcare should be accessible, equitable, and rooted in strong public health principles. Everyone deserves quality of care, regardless of their income, background, or where they live. Studies have shown that when healthcare systems provide universal access, disparities are significantly reduced. This is especially important in areas where systems are overwhelmed and vulnerable populations are the ones being left behind. That's why our position supports expanding access and building healthcare systems that work for everyone, not just those who are privileged. Now that we have explored the broader challenges and disparities between healthcare systems, we are shifting our focus to a critical part of the solution, which is social workers. In part two of our presentation, we'll take a closer look at the vital role social workers play in healthcare, from their day-to-day contributions to patient care to their impact on policy and system-level change. We'll also discuss the future of social work in this place and share some key takeaways for current and future professionals. Social workers are uniquely positioned to bridge gaps in care, advocate for vulnerable populations, and promote holistic, person-centered health solutions. Importance of social workers. Social workers play a major role in promoting advocacy, equity, and access, especially in marginalized communities. These communities are typically the ones where inequality is the most visible. Social works help clients navigate really complex systems like applying for Medicaid or getting connected to mental health services. At the core, social work and healthcare share the same goal, which is improving quality of care. And that's exactly why understanding healthcare is so important in our field. When it comes to healthcare, social workers take many important roles. For example, in hospitals and community health centers, social workers are often the ones managing cases, handling crisis interventions, and providing mental health counseling. Social workers also help their clients connect with many other important resources. They are often the ones who help people access things like shelters, support groups, and other safety resources, which can make a huge difference in someone's life and well-being. Social work operates both at the micro and macro level. At the micro level, we help individuals navigate the healthcare system and connect them to culturally appropriate care. On the macro level, we're involved in shaping policies that impact healthcare systems and advocate for changes that improve health outcomes, especially for underserved and marginalized communities. When it comes to the future of social work in healthcare, according to research, telehealth and integrated care models are continuing to grow. This means social workers will need to adapt to these tools while still maintaining that personal connection with their clients. At the same time, policy advocacy will be a big part of our future. Social workers will have major influence in shaping legislation, especially around insurance, access, health equity, and protecting patient rights. The future of healthcare isn't just medical, it's also social, and that's where we come in. In conclusion, healthcare and social work go hand in hand. They're both deeply connected by the shared mission to promote well-being, dignity, and human rights. As social workers, we play key roles in improving access to care, whether that's by advocating for change, helping people navigate through complicated systems, or offering trauma-informed support. Our job is to make sure no one gets left behind. We prioritize equity, prevention, and teamwork across disciplines so that healthcare serves everyone, not just those who are privileged. That's the future we are working towards. Thank you guys for your time.